All right, I am going to start well, we're not doing a hearing, we're doing executive session. Can, Cam, can you lead us in the pledge?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Um, do I hear a motion to move into exec? Second? I'll second. All right, so we only have, huh? Oh, yeah.
I just did a can.
All those in favor of exec? Aye. Opposed? Okay. We are in exec. I'm hoping the only one that we're not going to do today is 108. For those of you who do not know, Kevin Avard is in the hospital. He just had surgery for an
I just spoke to him. He thinks he will be able to go home this afternoon.
Yeah. So he had some questions about 108, and before I want him to talk to Rick Lehman to make him feel at ease before we exec that. So with that, I know we have agreement on House Bill 642. There is an amendment. And
I move 642 ought to pass.
I'll second. And do we have, I don't have a copy of it in here.
Neither do I.
Oh, really?
Katie, it's the one that the three of us are on.
Yeah.
1459.
Can you give Ezra a copy so we can make copies? What number was it?
1459S.
Say it again.
1459S.
Okay. So Senator Whitley moves Amendment 1459S. Do we need a second for that? I'll second. Okay, Senator Bradley seconds. Would you like to speak to?
Sure. So this is an amendment that the parties worked on together to address the concerns of the Disability Rights Center. And I think it's a good compromise. I don't know if folks had questions maybe of the work that the coalition did.
Sure. You want to come on up and discuss it?
Good morning. I'm Karen Rosenberg, the Policy Director at the Disability Rights Center. Thank you so much for considering this bill with the amendment. So what the object of the bill was to try to free up some funds that the Department of Health and Human Services, Bureau of Developmental Services has available to it to enable folks whose needs haven't changed, but whose budgets haven't changed for a really long time, to allow those folks to be able to increase their budgets so that they might be able to have more success in hiring direct service providers or creating programs that will help them to implement their service plans. Right, currently, there's not a mechanism to increase what has been known as legacy budgets unless the person has a change of circumstances. And so a lot of people's needs just haven't changed. It's just that their budgets haven't changed to account for inflation. Can I have a copy? Anyway, thank you so much. What I am looking at is the draft that we provided. So the Department of Health and Human Services was initially concerned about the bill because they're in the process of doing a rate redesign. And they felt that once the rate redesign is in place, that it won't be necessary for this provision to exist because people's budgets will be in accordance with what current rates are. And so what the parties worked on with that regard was to change the date by which access to this fund would be repealed. And so that's actually in the last section. And what the department proposed and Let me just see. Oh, this is actually somewhat different. Sorry, it's a good thing to look at. Well, I know. This is a little different than what we sent you, which is okay with from everyone's perspective, except perhaps possibly the department. I don't know if anyone's here from the department. What the initial request was, what that we forwarded was to give them an out in case the department was able to implement this rate design earlier. They wanted an out to enable them to certify that they were fully implementing the rate redesign and therefore could have the bill be repealed somewhat earlier. I need to tell you that the rest of that was the department's view. The view of the area agencies who participated in our negotiations and Disability Rights Center was that this wasn't really necessary because if people couldn't demonstrate that their service plans weren't being implemented, then they wouldn't be entitled to the funds anyway. So that is a difference. I don't know what you all want to do with that.
Senator Bradley, did you want to, I didn't realize that this was different than what was forwarded to us from the,
And we could amend it with a floor amendment.
okay. Yeah, I'm okay with the current version.
I mean, like I said, I don't think it really makes a practical difference because what you'll see when you look at, now I'm going to look even more carefully at the two versions,
Yep.
is that, okay, let's see. So basically and this does look right, or what, consistent with what we sent to you. So basically the idea is that if the person has a budget that's older than 24 months old and they are therefore, and because of that, they're unable to carry out their service plans, this gives the department the authority to use these non-lapsing funds to increase their budgets. So the person actually has to demonstrate that they require additional funds to meet their service requirements. So and this is why I think that the repeal date doesn't matter so much, because even if the department actually gets the rate increases into place right away, then the person ought to be able to meet their service needs. That's what the department is maintaining, that this isn't necessary once we've complied with the rate design and fully rolled that out. So if someone were to try to access this after the rate design, then the department would probably be able to say, like, you know, we did the rate design. You would really have to prove that you still can't meet your needs. So,
Madam Chair, so if I may?
Oh, hold on.
Yep.
Who did you work with on?
so I worked with Melissa Nemeth and John Williams, Alex Katrubis, Becky, whose last name I'm going to forget, from Area 3.
That's fine.
Yeah.
Because I just, what I think I'm going to do is, if we, I'll let you say your piece too. I'm thinking we'll go ahead and, like Senator Bradley said, pass it. In the meantime, I'll send this to HHS to talk to John and make sure this is what they wanted.
Yeah, I think that was what jumped out at me as the only difference. If you want to give me a minute, I'll do a more thorough review and compare. It's pretty short, because I did bring it with me. Go ahead.
I'm gonna let her do her thing.
I'm going to text John too.
He's probably upstairs in House HHS, would be my guess.
Yeah, the rest of this looks fine. Let's see. the other thing that was important to the area agencies that's included in here, was in both versions, is that from the area agency perspective, they wanted to make sure that all of this was, could be examined at some point. And so the department is required to track requests for funding, and including whether they approve those requests or not, and if not, why not. And then the department, it was important for them to be able to monitor how the funds were being expended. So there's sort of a parallel provision that requires the area agencies and other authorized agencies to record and provide the department with details showing how those funds were expended after they were allocated. So it's really just that one
Okay.
sentence.
Right, so what is missing? I'm just looking at
So
what,
do you want me, I can give you my,
no, I have it right here.
so what's missing is the effective date. It's section 3. Well, let's see, effective,
Is effective July 1st, 2025.
and then, right, and what the language we provided was, or an earlier date if after consultation with the Joint Legislative Oversight Committee on Health and Human Services established in 126A13, the Commissioner of the Department of Health and Human Services certifies full implementation of, you've got that?
I have it on this one.
Yeah.
Right, that's what was sent to us. I don't know why that didn't translate into what OLS got.
Okay, so,
We want to do a committee amendment with this.
Yeah, I think that's a better plan.
yeah,
Cam, I'm gonna send this, do you want me to send it to Jess or send it to you? Okay. I think that's a better plan.
I think the department would appreciate that because this was something that was important to them.
And rather do it now than,
yeah,
On
I
the
agree, rather
All
than,
right, I'll move the Whitley piece of paper.
Do you want to, do you,
Cam's gonna get it. I just sent it to Cam.
okay.
And so, so Senator Prentice can have it too.
so let me just, for clarification, the effective date says, Roman numeral 1, Section 2 of this act shall take effect July 1st, 2025, or on an earlier date if after consultation with the Joint Legislative Oversight Committee on Health and Human Services established in RSA 126-A:13, the Commissioner of the Department of Health and Human Services certifies full implementation of the developmental services rate design to the Director of Legislative Services and the Secretary of State.
Yes. And
And
then
the remainder of this act will take effect upon passage.
And then also, Cam, what you got now, there's an additional sentence that needs to be added after line 16, correct? Karen?
that's in there, isn't it?
Oh, okay.
Let's see. Let me just double check. No, that's correct. It's correct. I think what OLS did that was better is that they took the next sentence and bumped it down to Roman 2.
Okay.
Cam, you want this?
No, I have it right here. I got it.
Okay. All right.
So I second Senator Bradley's movement of the committee amendment as described by Senator Rosenberg. I was going to call you
Senator, you
Sorry.
promoted me. Wow, I didn't even have to run.
Counselor Rosenberg and what Cameron has in front of him.
Okay. All those in favor of committee amendments, say aye.
Aye.
Opposed? All those in,
I'll move ought to pass as amended.
Second.
okay. All those in favor of ought to pass as amended on House Bill 642 FN, say aye.
Aye.
Opposed? Senator Whitley, you want to take this
Yeah,
out?
yep.
Okay. It will not go on consent because we're down 1. Okay.
Thank you for saving us, Karen.
Yes. Okay, House Bill 408. Did everyone get a copy of this? We got the dropsies of the phones today.
Thank you for saving us.
And I wish there was someone from HHS here.
Abby Rogers, I think, is on her way.
All right, why don't we hold off on 408 till
Yeah.
they get here, and let's do 500.
It's okay. I think we have it all done. We don't need Melissa because we have the amendment that has DHHS's changes. Okay.
All right. So House Bill 500 relative to prescribing opioids via telehealth medicine. This one has, I've added language to it to mimic, Senate Bill 238. And my understanding is Dartmouth is okay with this.
Sorry.
Have the amendment, Matt?
Oh, okay. And are you okay with it?
Thank you, Madam Chair. Yes.
I guess you didn't have to get up.
For the record,
Get up.
for the record, my name's
Fall
Matthew
over,
Hood.
There you
And
go.
all you can do is say yes.
Trying to be brief.
He didn't drop his computer though.
For the
That's
record, Matthew Hood, Vice President of Government Relations at Dartmouth Health. To your question, Madam Chair, yes, the amendment language is, we're very good with it. Thank you.
Okay. Well, we need a motion.
I'll move, the bill ought to pass.
Second.
Okay.
Now I'll move
Discussion.
the Birdsall Amendment 1349 ought to pass.
Okay. Did you get that? Okay. Any discussion? All right. All those in favor of Amendment 1349S, say aye.
Aye.
Opposed?
I'll move ought to pass as amended.
And,
Second.
okay. All the,
Quickly, I just want to confirm.
Can you turn your microphone on, Senator? Can you turn your microphone?
Yeah, my phone. Yeah, hang on.
oh, that's you.
Oh, yeah, that's me. Can I call you later? Yes. Senator Bradley, I have a new case and it has a strap, so I won't drop it. I can wear it, as I go around. So I just maybe you want to try something out like this.
That's cool.
Yeah.
Oh, you can put it around your neck.
Maybe
Yeah,
a pink
I
one
know.
too.
Cross body, not around your neck. That's a danger.
That's
Injury
like
prevention.
yours.
Okay, so the effective date, as in the copy that I have and that's online, is upon passage. I just want to confirm that because this is so timely. So, we good with that? It's on upon passage. We don't need to amend it. I just want to
Is
confirm.
that what it is?
That's what
That's the
it,
question.
That's what it should be.
that's what it should be. It's what I have in my written copy.
I don't even have the original.
Cam, will
bill
you
in here.
confirm that for us?
I'm gonna bring.
Ah. Take effect upon passage.
Okay,
All right.
all good.
All right, well, we should check that to make sure that that happens on the floor, because, let me just address the concern. The public health emergency ends on the 11th, and it's my hope, I mean, we're in session, I'm going to ask that bill be special ordered to the front of the calendar.
Okay.
It'll be read into third reading, similar to what we did with the Sununu Center.
Great.
We'll send it directly to the House. Hopefully, Matt, you've done your homework and the House will concur.
Just because he does his homework doesn't mean the House is.
True.
Just like that, and the governor can sign it that day. Okay, so
Yes, good. Thank you, Senator Bradley.
Where are we?
I think it would be helpful for both sides to reach out to, I'll reach out to Sherm, you folks reach out to Matt, and to make sure that we fast track
Leadership.
this. Yeah, okay.
Got it.
Yeah, okay, good.
All right, the
Thank you.
motion is ought to pass as amended. All those in favor say aye.
Aye.
Opposed? All right, I will take this one out.
I think if I can just say one more thing, good job by everybody.
Yeah, thank you.
Um,
Love the team.
And they're calling Abby Rogers to come downstairs. Justice.
You wanna, do we need to recess?
She's on her way down.
Oh, okay.
And Madam Chair, we don't have any other bills coming.
We're done. Once 108 is done, we're done. I'm not sure that there's anything that we should be holding on to for ransom.
Yeah.
But, we
It
have,
feels like a lot of those might be in judiciary. Things that we need to hold on to.
yeah. Um,
We have a lot in
I
judiciary.
know, the Medicaid expansion, I'm not sure where they are on that. Do we?
Voting
They
today.
Are in exec session today. They just voted Senate Bill 85, which you folks may all remember. I think we all co-sponsored it. It was consent calendar bill. It is the 211 commission with a provision at the end that says, prior authorization for mental health should be treated in the same way as
Great.
substance abuse.
Great,
They
great, great.
ITL'd
Oh!
10-9. So,
Why?
well, Gary Merchant wasn't there. So that's one problem. And then the other 10, I have no idea.
Say that again? What was it?
It was 10-9. Gary
No,
Merchant
I-
wasn't there.
It was the making sure that prior auth for mental health lined up with the prior auth for substance misuse. Oh, there she is. Sorry to summon you, Abby.
So I think it's safe to say that we will probably want to attach that bill to something.
That's what I was thinking. I know that, I'm not sure we should be on record of this, but I know that, some of the House members are being pressured to, not pass it. So,
That particular bill.
hi.
Hi, good morning.
We're on House Bill 408, relative to foster children and the vaccinations. And, well, I guess we should probably,
I'll move on to pass.
and I'll second, for discussion purposes. We have an amendment here. And I know that HHS, you all worked on it.
Yes, we worked on the amendment with Representative Kofald as well as John Williams and Beth Marginson from the from DCYF and Kate Littman.
Okay. What my question is on this amendment, because I know I'm not sure I had a conversation with you regarding immunocompromised children. Will they be placed in foster homes that are not vaccinated?
Okay, so I'm Abby Rogers, Legislative Liaison, Division of Public Health Services. I can ascertain that I don't know what the inner workings of DCYF placement is. My colleague, Beth Margison, is really the person that handles the placement, could answer those questions today. But my understanding is this is, amendment is a way to sort of add some flexibility for those placement, at the same time by protecting children that are immunocompromised. So currently, in section 1, which adds that there should be no vaccination requirement for children other than that for other children for 141C20A. Currently, that includes all of the vaccinations that you would need for school or childcare attendance, with the exception of the flu vaccination. And then Representative Kofalt felt strongly about the department seeking a waiver with the Administration of Child and Family to try to further expand that any kind of exemption under 141C20C would allow children of all ages to have the religious and or medical exemption from vaccinations. Right now, currently, if foster family household children are 6 and over, they are allowed to have medical or religious exemption. But for children under 6 that are household members, those children do currently need to be vaccinated to protect a medically fragile child or an immunocompromised child that's placed in their home.
And what does this language do for those?
Well, currently the language would say any children residing in a foster care situation would have to have all the standard immunizations.
And therefore, the family can ask for a waiver?
Well, we would actually, there is a waiver currently for the COVID vaccine, so no family is required to have the COVID-19 vaccine. This additional waiver would be something that the department would file to have some additional flexibility in that area. I think the sponsor's concern was that all foster children, regardless of age, should be able to have that religious and medical exemption, and that's what the waiver would inquire with the department, the Administration, Child and Families about at the federal level.
Okay. So really nothing's changed except for the possibility of having the foster children religious exemption waived.
Well, with the exception of generally their recommended vaccinations for foster family household children. And this would basically say that under RSA 141C 20A, currently the influenza vaccine is recommended but not required. So that would not be required for children that live in the foster family home.
Go ahead.
Thank you. Is the waiver that is required in section 2, is that for particular foster families, or is that sort of a general waiver?
Thanks for the question. That would be a general waiver. Basically would say that currently children that are 6 and under that are household members do have to have the required vaccination unless they host a child that is 6 and over. So this would mean that any foster family household member child would be entitled to religious and medical exemptions.
Follow up? Yep. So I know you worked on this, but does DHHS, can you assure me that that DHHS feels that this adequately protects vulnerable children?
We feel that the language regarding RSA 141C 20A absolutely does. The way that the waiver works is my understanding, and I'm sorry my colleague is not here to fully better explain this, is that we would submit a waiver to the Administration for Child and Families, and really as the licensing federal agency, they would weigh in on whether that was something that would be able to be completed and done for New Hampshire. My understanding is they're pretty flexible with states' requests, so we're fine with this language.
Follow up? Because I remember there was some conversation about we could lose some federal funding, and so does this adequately address that?
My understanding from this is that when the waiver is filed, if the waiver is approved, I don't think that would affect the federal funding at risk, because the agency would be making an exception for the state.
Okay, follow up. So what happens if they deny the waiver? The requirement is still in place, so will that put us out of compliance with federal law if they don't approve the waiver?
Right. My understanding is that certainly the language in line 4 through 7 would still apply. The waiver in section 2 is to basically require that all children all household children under the age of 6 would be eligible to have a medical and religious exemption. Currently, if you host a foster child that is 6 and over, only then are those household children able to have the religious exemption. Medical is always required. So basically what the waiver would do would say if you have a 2-year-old household member.
No, but what I'm asking is if we don't get the waiver,
Right.
if they say no, you can't have that waiver, then this is the section 1 is a shall, and so that will be our state statute, and will that put us out of compliance should the feds deny our waiver?
I don't
That's my
believe so.
concern.
Yeah, I don't believe so. I mean, I think that's, again, I'm sorry, Beth is not here to answer this question more particularly, but I would assume that we will apply for the waiver, and if that waiver is granted, then we will be able to do that. I don't have any understanding really on whether federal funds will be at risk. I think that if they approve the waiver, I think that's obviously those funds, then they've made that exception for New Hampshire, and I don't think the funds will be at risk.
Okay, so then I think that we need to put some additional language in there about what happens if we don't get the waiver, because that would put us out of compliance with federal law and risk federal dollars.
And I think we're going to hold off on this because I'd like to talk to Who was it?
So Beth Marginson was in the meeting with the sponsor and also with the policy director, and she did not have any problem whatsoever with the language. I can just say that. So.
I
So if
just-
you don't mind asking her that question about whether we need to add language for what would happen if the state was required to comply with section 1 and we did not receive the waiver.
Sure, I'd be
Okay,
happy to do
great.
that.
That'd be good. Thanks.
Agreed. My only thinking, I'm processing this, even though, is it federal law overrides state law in many cases? I'm wondering if federal law would override that.
Well, there would be a conflict between our
Yeah.
state law and federal law, which I think would be problematic.
Okay, so yeah, if we can get some clarification on that, that would be great.
Sure,
Before
absolutely.
we move forward. with
Okay,
this.
thank you very much.
Thanks. All right, so we want to rescind our ought to pass?
Yep.
All right. So we got 2 done. Now what? All right, so I understand there is a problem with 500.
Sorry, for the record, again, Matthew Hood, Government Relations at Dartmouth Health. Thank you, Madam Chair. As you know, the House and Senate introduced somewhat similar bills in this space. The House HHS is currently meeting, and they are planning on doing a replace all of Senator Prentice's Bill 238 with HB 500. This is fine. This is okay. But that's the issue for HB 500, which you're tackling right now, is the hope is to make it identical to the language that the House will pass or presumably take up. In order to do that, the language that you provided with respect to consent only goes in one section, and the House version goes in 2 sections. It goes in one section with respect to physicians prescribing. It goes in another section with respect to nursing. And so my request is to reconsider to just add the same consent language, Madam Chair, to the nursing provision so that the bill is identical to what the House presumably passes and it doesn't run into hiccups back and forth with varying versions. We just noticed this. I apologize.
It's fine.
I'll move to reconsider our action on House Bill 500.
Second.
Okay,
And I can provide the statutory reference for where it should go if that would be helpful, Madam Chair.
it would be.
Is it the 326?
Oh, I'm sorry.
Voting.
All those in favor of reconsideration, say aye.
Aye.
Opposed? Okay.
Thank you. 326B2. I need like 8 pair of glasses. 326, thank you, Senator Prentice. Yes, 326-B:2. That's the section.
Okay.
I will propose a committee amendment to add lines 8 through 12 to RSA 326B:2 in the appropriate spot.
Second.
All
Thank you.
right,
Sorry.
Is everyone okay with?
Yeah.
Okay.
Do we need to move the amendment again too? So we just moved that Go ahead.
We reconsidered,
Yes, good point. So I will move amendment 1349 with the addition of lines 8 through 12, also added to RSA 326B2.
And that I will second.
all eyes on you, Cam.
Kim, are we good procedurally?
Yes, we're good procedurally. I was just looking at RSA 326B2.
Uh-huh.
That's the definition section? 326B2?
The section you would be, sorry, the section that that language would be added to is B.
Put your glasses on, Matthew.
It's not helping. Sooner.
Yeah.
It breaks over 2 page, and I have short-term memory issues, and I'm just trying to allocate the right provision.
By the house.
Right? 12, yes,
326B2.
12, Roman 12.
7A through C. Yeah. So what it is in the definition section. It says telemedicine means blah, blah, blah. Yeah.
12C. Thank you.
Okay. Got it? All right, where are we now?
So we don't have to withdraw the previous motion?
So Senator Bradley moved a committee amendment that includes 1349 plus the committee amendment inserting this language that's on lines 8 through 12 into RSA 326B2. Senator Bradley did say in the appropriate place. We
I
figured
will
out the
say-
appropriate
I will
place.
amend my amendment to say in the appropriate spot of RSA 326.
And second that.
All right. All those in favor of the committee amendment, say aye.
Aye.
Opposed? All those in favor, oh, I need a,
I'll move on to pass as amended.
I'll second. All those in favor ought to pass as amended on House Bill 500, say aye.
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 Opposed? And Senator Birdsall, you still have this.
Thank you very much, Madam Chair, members of the committee. I apologize
thanks
for
for the
that.
catch.
For
Yeah.
that.
Thank you.
They should be aligned, and I will go upstairs and try to do the second part of my homework, Senator.
Do what?
Make sure this.
And we will too. Madam Chair, do we need to stay in executive session a little bit longer, depending what they do upstairs? Or are we okay?
Can we recess?
We,
In particular, I'm concerned with SB 85.
So I think we can do 85.
what do you mean? Oh,
We'll have to think about that. Which bill?
oh, the,
Oh, yeah, maybe
211.
this will actually is a perfect one to do it on.
Well, I mean, I thought maybe to do the bill that we just dealt, 642, but I don't know what the best target is.
Well, the House, I think, is
And
They
the House
really
might
like their
overturn
500.
it, but
Yeah.
at the same time, just shocked.
I just have to step out, make a quick call.
Thank you.
Do we want to recess or do we?
I think we're all in agreement. It does not have to be an HHS bill.
Ah.
It could go on education savings accounts. Just trying to make your life.
Mr.
easier,
President.
Senator.
Okay.
Judiciary, a judiciary bill, maybe.
Yeah, we have 100 of them.
Yep. All right, with that, with our business for today, do I hear a motion to move out of exec?
I'll move. Second.
All those in favor say aye.
Aye.
Opposed? All right, we will not meet next week. Or you can meet, I won't be here. And hopefully the next week we'll finish the last two bills.
Yes.
Yep. Thank you.
So the next meeting's going to be Wednesday, the 10th? Is that right?
Yep.
Okay. At 10 a.m.?
Yeah. Is everybody okay with 10?
Yeah.
Okay.
So is that on your agenda?
I just gave Senator Bledsoe the eyes. We're good.